Hi, everybody. I'm Evan Veration. I'm the coordinator of our school district's Family Support Center here in Clarence. And today we have Horizon Health Services coming in to give a presentation on suicide prevention. Um, we'll be posting this on YouTube as well, so feel free to watch it. Go for it. Um, one of the reasons we're trying to put out these events more than anything is to just make sure that we have information available to the public, to parents and students and other community members to hopefully prevent crises from happening, or if there is a crisis that is happening with yourself, with a loved one, with a neighbor, family member, a friend, that we have some tools to kind of help them through that process and know what to do. So I'll leave it up to Shacarah to continue, and we'll go from there.
Thank you, Evan. Yes, hello. Hi, everybody. Thank you for listening in and being available. So we are going to be talking about suicide prevention today. Suicide is a sensitive topic to discuss, but talking about it is really important. So we want to make sure that we are making efforts and doing that. Just a little bit about me. Like I said, I'm Shacarah. I'm a clinical supervisor at one of the outpatient clinics for Horizon Health Services. So I work with counselors. I have some clients that I work with still. So really just helping them to help our communities kind of be everything that they can be and want to be, reach their goals. I also do presentations in the community, making sure that everybody is aware of the different needs and being able to have discussions and open forums about what is going on and how we can help. So we're going to go through some information today so that you have access to that, and any questions, comments, concerns, anything like that. My information is at the end. And so you can feel free to reach out to me via email or give me a call if you want to talk further. So yeah, like I said, suicide can be very complex, right? It has a lot going on for it, but suicide can be prevented. I have a cute little statistic here from the CDC. 45,979 people died by suicide in 2020. So that is about a suicide every 40 seconds worldwide. So definitely a global problem. It does not discriminate. And so we want to make sure that we are talking about it with everybody. So I'm going to go through some important, just kind of like concepts and everything first, just in case you're not familiar, or it might be a refresher if you are. This is kind of just the agenda items that we're going to go through, so can just kind of be read through quick, just so you know what we're outlining today. We want to make sure too, just kind of highlighting first, is that there's a lot of things that we've learned about suicide and, kind of where that comes from. And so we're going to go into that a little bit. And we know that people who think about, experience, attempt suicide, their brain actually tends to differ from those people who die from other causes. So we know that there is a lot of components that, even just like the thoughts and experience of that, really transitions over into how people are continuing to experience life and functioning, whether they have completed suicide or they've just attempted. We have also learned that most people who are having suicidal experiences are ambivalent about taking their life. Part of them wants to live, and part of them wants to die. So we always want to make sure we're keeping that in mind. So like I said, so just some important concepts. So essentially warning sign versus risk factors. So really it's exactly what it says on the screen here. Again, this is just a refresher potentially for some people, and then for other people, it might be something that you're just learning for the first time. So a warning sign is that early signal that something bad or dangerous might happen or is happening. Right. And then risk factors are things that increase the likelihood that people are going to develop some type of health issue. So we just want to kind of have notes of those, because we're going to see that the warning signs for some people who may be suicidal are going to be different. So you want to make sure you know kind of different ones for different people and what they might be experiencing, and then risk factors that might be contributing to that. Some other concepts, really just kind of differentiating between suicidal ideation and suicidal behaviors. So ideation is thinking about suicide. So that's, I wish I wasn't here, or nothing matters. I wish I could just go to sleep and not wake up. Behaviors are the actual acts to prepare themselves to make an attempt. So for people who maybe are thinking about overdosing, maybe they are stealing pills or collecting pills, saving pills from prescriptions that they have. Maybe they're buying a weapon, or like just maybe kind of being more interested in the family weapons, like if there's guns or like other things in the house. That can also mean like knives and that kind of thing. And most of us have like kitchen knives and everything in our homes all the time. So it's just kind of important to be paying attention in general. Giving away possessions, that's another kind of behavior, or just kind of like not really having maybe as much connection with their stuff, right? Their things, their belongings as they once did. Saying goodbye to people too, right? Or like kind of losing connection with people that they would have been spending time with before. This is another concept that I definitely wanted to make sure that we were talking about, just the difference between self-injurious behavior or self-harm, we tend to call it, and like suicide attempt, right? So self-harm is a harm to self without the goal of ending their life, right? So this can be cutting themselves, burning themselves, choking themselves, hitting themselves, banging their heads up against a wall, like anything really kind of like hitting related to that, versus a suicide attempt, like the harm to self is with the goal of ending their life, right? And it's an attempt because they don't die when they do it. So when someone has a suicide attempt and then passes away, we call that a completion of suicide. So that's a completed suicide. There's some old terms about kind of committing suicide and that kind of thing. The language has really changed just because some of the language that we used to have actually increases the stigma around people who have mental health challenges, substance use challenges, and then also experience suicidal thoughts as well. So an attempt, goal is to end their life, but they might not die from that attempt. Okay, so I like to put this one in here just because of the importance in our kind of day to day. Most of the times we are actually seeing people with co-occurring disorders. Yes, it might be a little tough for you to read on here, but essentially what that means, co-occurring is that someone has a mental health disorder and a substance use disorder. Okay, so co-occurring, essentially two or more disorders occurring in the same person. And tends to be interactions between them that can worsen the course of both of them. Right. And so this is what we're seeing a lot. And so that's why I think it was really important to put in this presentation, even though this presentation is mostly about suicide prevention. We have to be aware, right? We can't prevent anything if we're not aware of what's going on. And so we have to be aware that mental health may cause people to use substances. Substance use may cause people to experience mental health or worsening mental health. And so both of those things together is really making up this whole person and could potentially be the cause of suicidal thoughts and them making an attempt on their life. The statistic on this one, 2018, approximately 9.2 million adults in the United States have a co-occurring disorder. There is enormous numbers for youth as well. But I think that if we are thinking 9.2 million adults, we can really only imagine what that is in our youth, right? So that's under 18. So this one is a little bit fuzzy, but essentially what you're seeing here is just different levels of care, right? And so I think that's important for everybody to know that it's not just you go see a therapist in the community or you go get locked up in a psych hospital. Like that does not happen really anymore. But that is definitely an old additive that people sometimes still think. But so we have different levels of care. And so at the top one is hospital, right? Or like kind of specialty treatment. So that's that kind of number one up there on the top. Then we kind of go down from there, right? And so residential. So that's maybe they are going into treatment for like 3 months to like 6 months. Some people will go in for a year, depending. And they're just kind of getting treatment while they're there throughout that whole time. So it's definitely a more intensive level. So like hospital being most intense and then kind of coming down from there to residential. Number 3 is in-home care. That doesn't happen as much like in this area. There's not as many options for kind of in-home care, but some school-based programs do this. Some community-based programs do, where they send a counselor to go see a child or adult in their home. And then we go down to partial or day treatment. So that's partial hospitalization. That essentially means that they are going for the day. Usually it's about like 9 to 2, 9 to 3, and then they go home at night, right? Intensive outpatient, that is having multiple services in a week. So usually like 3 groups in an individual or 3 groups in a couple of individual therapy appointments. And then again, they are at home, right? They are living out in the community. They are not in anywhere where they're getting kind of 24/7 monitoring. And then the bottom one is kind of where I live at the outpatient clinics. That's what most people think of as traditional outpatient therapy. That's you're going to see your counselor once a week. Maybe you're doing a group or a couple of groups. So I put this in here because all of these things are a bit like have their level of importance. Some people need that really high and kind of intense level of care, especially if they're experiencing suicide. A lot of, kind of some direction that people go when they're experiencing very severe suicidal thoughts, have maybe made some attempts or are planning on making an attempt. The safest place for them to be is in the hospital. So people, you've probably heard ECMC, CPEP, Niagara Falls Memorial, those places do kind of like a 3 to 5 day hold with people. Some people go voluntarily, some people do not. But really at the end of the day, it's about safety, right? It's about trusting our gut. It's about making sure that these people are safe because we can't help them if they're not alive, right? And so we want to make sure that we are considering safety first and then going from there. Some people experience suicidal ideation. Some people have made several attempts throughout their life or have had suicidal thoughts with plan and intent, but they have not acted on them. And they can continue in the community without going to the hospital. Usually for those people, we'll do our best to increase their services to give them more support. The only thing in this that is not on this, which I would kind of categorize probably with the bottom row, that light blue, is just community-based support. So peer support specialists, recovery coaches, support meetings, church groups, like those types of things are super important. We recommend that everybody kind of has those wrap around services that they can access because it is very important. Okay, so I wanted to just put some facts and statistics in here so you can kind of read the ones that are up here on the screen. And while you're doing that, I'm just going to provide some information. So women are more likely to attempt suicide than men. Men are more likely to die by suicide than women. And that is because men are more likely to use very lethal means like firearms, hanging, and that kind of thing. And so the lethality risk is a bit higher just because of the means that they're using, right? You're more likely to die from a firearm than kind of like overdose on some type of medication, right? Native Americans and Alaskans have the highest rate of suicide, followed by non-Hispanic males. And the rates of death by suicide in preteens and young teens is still lower than older adolescents and adults, but the rates are increasing very rapidly. And I think that that is something that has been really in the forefront of everybody's minds and really something that you can very much see since COVID. I feel like it's kind of really taken off, unfortunately. So we are seeing those rates rise at a very, very quick rate, which is very scary. Children under 12, Black children have a higher rate of death by suicide than white children. But as we said earlier, suicide does not discriminate. And so even if you think that your kid is doing well or a loved one is doing really well, it does not mean that at some point they have had thoughts of suicide, even if they were not serious thoughts of ending their life. So it's always something to just kind of keep in mind and definitely changes in their mental health, changes in their mood, the behavior, everything like that could point in the direction that some assistance is needed so it doesn't get to that point. So the ones on the screen, 10th leading cause of death in the US, second leading cause of individuals between the ages of 10 and 34. And that actually, they do believe that that statistic is actually incorrect now and is actually the first leading cause of death for individuals between ages 10 to 34. And estimated to be 25 suicide attempts for each death. So about 1 million attempts per year. Okay, so I talked to you about warning signs earlier, let you know about the risk factors earlier. And so then these are just different ones that fall under the categories, right? So if we're thinking about warning signs, we talked, like I said, warning signs are those things that tell us that something bad might happen or is currently happening. So they might be talking more about death, about killing themselves or wanting to die. You might notice, or they're talking about hopelessness, right? Like they don't have any hope or they feel really helpless in their life. They might be isolating from other people, so not spending as much time with family and friends, maybe spending time in their room more often or just kind of like away from everybody else. Seeing a lot of different mood shifts, talking about their pain, physically or emotionally being very unbearable. Chronic stress is a warning sign. Chronic prolonged stress deteriorates our body and our mind very quickly if not addressed. Relationship issues. So, a warning sign is they might be literally having issues in their relationships, right? Which then can cause them to have thoughts about suicide or um, just having it like they might be really struggling and it's causing issues in their relationships, right? So it kind of goes both ways. Increase in alcohol or drug use, and then changes in habits. Usually it's sleep and eating habits. So appetite changes, trouble sleeping, trouble staying asleep, not sleeping at all, those types of things. Risk factors. So the biggest one I would say that people need to pay attention to is, have they attempted before? Are they experiencing and struggling with mental health challenges that have not been addressed or even talked about? Trauma history, abuse history. So that's sexual, physical, mental or emotional abuse, family history of suicide and mental health, and recent release from a hospital or a jail system. After someone attempts, when like those first kind of I think that it's still 10 days, kind of like the first like 10 days are the most kind of risky days for somebody after they've made an attempt or after kind of being in a controlled environment. So that would be your hospital, your jail, something like that. Because now they have kind of all of this freedom that they didn't have. They don't have 24-hour support like they did before. So it is the most risky time for people. So something to pay attention to. Most people with these risk factors will not actually attempt. So we have no specific information that tells us someone will or will not act on the thoughts that they have. So it's just important to be aware of the risk factors. What's more important is to be aware of the warning signs. Okay, the warning signs of suicide on the left-hand side there. Higher risk of danger and more in need of immediate attention when kind of these warning signs start to pile up for somebody. Like I said earlier, like the things that you're going to pay attention to or want to pay attention to and notice the most is their talk, their behaviors, and their mood, right? So like, how are they talking? What thoughts are they saying they're experiencing? What behavior changes have you noticed? And what mood changes have you noticed? So watch for the warning signs in yourself and other people. This is not an exhaustive list. The warning signs of the risk factors. They tend to endure over a long period of time also. Warning signs are observable. Risk factors are things that we kind of have to know and kind of come from our knowledge. They're not necessarily always going to be observable on the surface. So keep that in mind. Okay, so we're not going to really do this the same way that it was planned. So I'm just going to kind of go through them. But if you guys want to guess, you totally can. It does make it kind of fun. So let me know. But I want to make sure that the information is here, right? And so the reason that I include things like this in my presentations is because if we're not talking, like if you're coming to a presentation, right, or you're listening to information and you can't think about, reflect, and have a discussion about what's actually going on, it's going to be really hard for you to have discussions like this with the people that you need to be having discussions with, right, in your own life. So I always like to kind of do a little interactive piece. Okay, so thinking about suicide will make someone think about suicide. Myth or fact? It is a myth. That is very much not true. If someone is thinking about suicide already, you talking about it is not going to make them think about it more. You're not going to cause somebody to have thoughts of suicide if you ask if they're experiencing thoughts of suicide or if they've thought about suicide before. So that is one of the biggest and like most common myths. I would say that's actually even something that comes up for like newer like clinicians too, like therapists, especially like kind of going right into grad school. I mean, sometimes even coming into the field, is that they get very concerned about like, well, if I ask if they're having suicidal thoughts, or if I ask if they have been thinking about harming themselves or have, then I'm going to like place this idea in their head. It just doesn't really happen like that. People are probably already thinking about it, and they're probably getting it from other sources before you anyway. Okay, question 2. Limiting access to lethal means is helpful to prevent suicide. Myth or fact? Yes, it is a fact. Okay. So during a period of high risk, right, it is the trying to make a safer environment is definitely the better chance of helping a person who is experiencing suicidal thoughts live through that crisis period. For people who are at a crisis point, the most important thing you can do is put between that person and their way of ending their life is time. Right. So if we can kind of get them out of this crisis period, they are much safer, much less likely to act on any type of thoughts that they're having. Research does show that by temporarily reducing a person's access to lethal means, we give that individual time, and that time allows for different actions to be taken, whether it's individual kind of like self-coping or getting them some type of help. So we are, getting them into a better place. And for the majority of people who experience a suicidal crisis, if unable to access their chosen method even temporarily, they are less likely to engage in another action to end their life. So really, it's just, like I said, it's time. It's getting them out of this crisis period. Okay, number 3. The only help for suicide is hospitalization. Myth or fact?
Myth.
Myth, yes. Many people with thoughts of suicide and those who have attempted in the past can be managed in therapy without having to go back to the hospital or even go into the hospital for a first time. Like I said though earlier, right, if we are very worried about people's safety and that it is getting them into a hospital is a very important step that can be used, but it does not need to be the only step for everybody. If you, like I said, you got to trust your gut though. So if you're like, this person is not going to be able to stay safe, if they are not able to tell you any type of way that they can stay safe, that they can make it through this crisis period in this moment, the best option is most likely the hospital. But there's even avenues for that. So everyone thinks kind of like, well, if they got to go to the hospital, we got to call the ambulance, right? We do not have to call the ambulance, right? Do they have a loved one that is willing to drive them? Can we call to crisis services and have them do kind of a mobile outreach, right? They have, Buffalo has their mental health unit now, right? They try to have more people being sent out that have mental health experience that can help people through these different crisis periods. If we can get them to go voluntarily, then they don't have to go involuntarily. So the ambulance is not the only option. We definitely try, if we can, to get a loved one who is willing to take them, kind of be with them as they're waiting to get assessed and admitted. Then it feels more comfortable to be there. Some people are fine with going on their own, but obviously the ambulance is always an option if it needs to be. Okay, question number 4. If someone engages in self-harm, that means that they want to die. Myth. Yes. Okay, so that is a myth because of what we talked about earlier. A lot of people that engage in self-harm, their intention is not to die. Their intention is because they want to release pain that they are experiencing, right? This is their only way that they feel like they can release this emotional pain that they've been experiencing, and they're not really sure any other way to go about it. So it does not necessarily indicate that they are having thoughts of suicide. Like I said, a lot of people actually describe why they engage in self-harm as a way to release that emotional pain, right? To try and kind of get that control back over their lives when they don't feel like they have any. Self-harm can lead to a suicide attempt or an accidental suicide attempt. So that's typically what we see a lot, is that someone is engaging in self-harm, cutting, something like that, choking themselves, and they accidentally take it too far. So there are a lot of accidental suicide attempts from engaging in intense self-harm. So that is still something to be aware of. Okay. Did I put this in here twice? Hold on. I might have put the same question in twice. I did. Okay, moving on. Okay, so I will say though, like on that one, like I said, gestures can lead to death. So just kind of pay attention to it because there can be miscalculations. Okay, question 6. After someone attempts suicide, they are more likely to attempt suicide again. Myth or fact? Yes, it is a fact. You guys are doing really well. So we also know that so first 10 days, highest, right? Highest level of risk posed for this individual to reattempt or just to really be struggling. But we do also know that the first 30 days following the first documented ideation is also one of the most risky times for an attempt. So that's just kind of like a side fact. So the first 30 days following the first documented ideation, so that's that suicidal thinking, is the most risky period of time for an attempt to happen. Number 7, a true attempt is when someone has clear intent and expectation of death. A true attempt. Yes, that is a fact. So it just kind of has those two important components, like we were talking about earlier, is that someone attempts suicide because their intention, right? Like the goal is to end their life. It doesn't always mean that it happens, but that is the goal. So they have a clear intent and expectation of death, whether it happens or not. Question 8. Some people threaten suicide to get attention. It is a myth. Yes. So, it does not mean that people do not talk about suicide more often. It doesn't mean that people do not engage in all sorts of different types of attention-seeking behavior. That is part of a lot of different diagnoses and mental health challenges that we work with. But we always want to make sure that we're taking suicidal statements seriously. And some people have them more often. There are people that have chronic suicidal thinking. So they could be thinking about it every day, multiple times a day. They can have a plan sometimes, not a plan other times. They can have plan and intent to act on it, and not other times. Sometimes they act and sometimes they don't, right? So we always want to take those suicidal statements and conversations seriously. Suicidal thoughts or actions are a sign of extreme distress and an indicator that someone really needs help. So talking about wanting to die by suicide, I think that we can all kind of say that's not a typical response to stress. So when someone is talking about suicide, dying by suicide because of stress or because of anything else, we definitely want to take it seriously. Hang on, I did want to say something about that. Oh, yes. So that's what I was saying earlier. So some people will discuss suicide as an option to deal with stress, and that doesn't necessarily mean that you need to go like DEFCON 5. Is it 5 or 6? Whatever that statement is. I'm really bad at those. Like I know that they're in my head, but they don't always come out correctly. So basically what I'm saying is like your brain does not have to go into like survival crisis mode if someone is talking about having thoughts about suicide as a way to manage their stress. Because if we really think about it, and this I guess could be a slightly controversial thing to say, but like suicide is an option for everybody, right? Like you can end your life at any point in time. Like it is always an option. And some people talk about that as being an option for them to end the emotional pain and what they're suffering from and experiencing. And one thing is chronic stress, right? That is a warning sign, is prolonged unaddressed stress. So people will talk about suicide as an option for that. We want to take it seriously. We want to provide and give the space that they need to be able to talk about it. Because a lot of times just being able to discuss what's going on for them and what they're thinking really helps people tremendously, and it actually can like lower and reduce their experience of distress and their experience of having these thoughts as well. I work with a lot of people. All of us have had a lot of conversations around suicide, and we have a lot of clients and patients that we work with that experience thoughts of suicide. We have people that have literally been on the phone with people in the midst of like, I'm going to do this right now. I'm going to jump off this bridge. I'm going to take these pills. And just being there as an active listener, providing them the space to just talk about their distress and what's going on has saved a lot of people from acting on it in that moment. And it's not always going to. We can't always help somebody. If someone wants to end their life, they're going to do it. right? Like if someone wants to do that, they're going to take the steps and they're going to do it. But a lot of people just need the space to be able to talk about it and not feel judged or shamed for having the thoughts to begin with, because it already can be very scary to have them. Okay, so that's my myth fact section. So you guys did a really good job. Okay, so supportive strategies. So I am going to go through each of them, but as we're just kind of talking about prevention efforts, we want to include supporting those people who have experienced and been touched by suicide, right? They have attempted themselves, or they have loved ones who have attempted or completed suicide. The loss of any person to suicide can be very profound. It can cause a lot of grief, distress for people who experience that. So it's important that survivors also have the support that they need. So survivors who have attempted themselves, and then also kind of like loved one or support survivors of people who have attempted and completed, passed away from suicide, so that they can heal and reduce their own suicide risk as well. It is a lived experience that a lot of people have, which is really sad to say. So we just want to help as much as we can. So like I said, I'm going to go through each of these individually. So what we have first here is the platinum rule. So when in doubt, treat others as they want to be treated. Okay, so part of the platinum rule is to be open and curious in conversation, to recognize that each person has their own values, has their own life experiences. If you don't know, ask. When it comes to suicide, ask directly. Don't beat around the bush. Right? Just like ask, talk, be direct. If you make a mistake, right? If you make an assumption, if you make a judgment, own up to it, apologize, and try to keep moving forward in that relationship. Trust, safety, comfortability are the most important things in relationships, and are going to be key indicators that someone is going to be willing to talk to you if they're experiencing thoughts of suicide. If they feel those things, right? That trust, that safety, that comfort. So creating safe space, noticing changes, having empathy, being that active listener, right? They need that space to talk. Just be that active listener. Don't try to fix everything, even though that's a lot of our kind of first initial reactions. Like, you're having thoughts of suicide. All right, let's get you somewhere. Let's get you talking to someone. Some people just need to be heard and validated, and that really goes a long way. So acknowledge, offer help, but don't force it, right? Just offer it and be patient. Not all conversations are going to go super well. Some people will get up, they'll walk away, they'll be pissed at you, all sorts of things. So you got to be patient. You got to be there to support and offer that help, and know that sometimes people are going to take it and other times they're not. You definitely want to avoid a couple of things. So you want to avoid minimizing their feelings. So people who have never experienced major depression cannot imagine what that feels like, right? And it's okay to acknowledge, like, I cannot imagine what that feels like. We want to avoid trying to convince them that life is worth living, right? We can ask about protective factors, right? Like we can ask about, like, what does make you want to live and what makes you not want to live, right? Like we can have an open dialogue, but we do not want to try to convince somebody that their life is worth living, because a person who is in a crisis period, right, or kind of at that crisis point, is not thinking in their most clear mind. And so philosophical debates and why life matters does not tend to work out very well. And it kind of just goes in one ear and out the other, or it pisses people off and they just end up walking away. And then we want to avoid, like I said earlier, we don't need to try and fix everything in that moment all the time. So we want to try to avoid that like fix it strategy, and just kind of let people have some space and have their autonomy to kind of choose what they do next. And that can be very scary of a space to live in sometimes, because again, someone might choose to end their life, and we can try for the safety, we can try to get them the support. That is always top priority, but we're not always going to be able to do that. So keep that in mind. I did want to just kind of pop this in here. So this is just an example of a safety plan template that we'll use. And I think it's something that like even like loved ones can kind of like have the different pieces involved. I know us as counselors will use this or like different forms of this, and we'll make sure that kind of loved ones in people's life know what the plan kind of looks like. We'll send a copy home with like our client, our patient, but then we'll also try to either have a phone call, in person session with the family member so they're aware too. But like I said, these are things that like loved ones can kind of have a plan around and everything too. So warning signs, right? So that's just finding out like, how does this person know that they're not doing well, right? Or that shit's about to hit the fan, right? What coping strategies, right? Like how do they cope when things aren't going well? How do they take their mind off of problems? Like what are these healthy ways that people can go about this? I will tell you, and this does kind of put people off sometimes, is that sometimes people will answer that their way of coping with their problems is to get high, right? So to like smoke weed or something like that. And yes, it might not be the healthiest of options or maybe the most helpful long term. But for some people, it does keep them away from hurting themselves further. Right. And so we need to really kind of not be thinking about things so black and white. And we really need to try and live in the gray area that is life, to understand that we have to kind of like, where's our energy being put, right? I'm going to kill myself, or like, I'm going to smoke weed because it helps me for a little bit and gets me out of this crisis period. Like, are you going to fight about the weed if they're still alive? Right. Like, that's not the problem right now that we need to be tackling. Right. Like, we want to make sure that they're safe and not trying to harm themselves further. Social settings, social settings that provide a nice distraction. So that's basically people in places that can be really helpful. And then who do I ask for help? So people in my life that I can ask for help. And then there's also professional or like agency places that you can call or ask for help. And then the last one, very important, how do I make sure my environment is safe? We know that not everybody lives in safe environments. It's really sad. We work with a lot of people to try and figure out how do you make your environment safe, even if it's an unsafe environment. Right. So that's on there. Okay. Awareness through action. So again, right on here. So regular check-ins, normalizing challenges and failures, making sure that you are reaching out to other supports in people's life, knowing like what they're doing, especially with kids, good ones to reach out to teachers, coaches, school counselors. These are people that see them every single day. Self-reflection. So really kind of normalizing, either like journaling or just kind of personal, like kind of like introspection. SUD scale actually, so that stands for subjective unit of distress. That's what SUD means in this framework. It's basically a 1 to 10, or 0 to 10. 0, 1 being completely relaxed. I'm good. I'm in no distress. 10 being like the most severe distress that anyone's ever felt. I recommend using this with everybody. I use it personally. I use it with my clients. I use it with my staff. I do it in my presentation sometimes, ask them to rate themselves. So this is something that anybody can use. Right? Like you do not have to be a professional to use this idea because it is just a check-in on where you're at. So, you know, like if I'm at a 10 and I don't like this, I need to figure out like, how do I get myself down from that? How do I get myself to a 9 or what have you? Or we can recognize like, oh, I'm at a 5 right now. So I need to do this to bring me back down. And this thing might bring me up further. Right? So it's just creating more self-awareness. Safe space, so a healthy timeout, a place to take a break. This is something that I encourage people to have at schools, in their homes, that this is just like your timeout time, right? This is like, I get to take a break. I just get to hang out with me, think, or just like sit, breathe, do whatever. And then self-care. Self-care is very important. It's something that people think is really silly a lot of the time, but it is essentially just taking care of yourself, which is very important. So you can do any type of thing that is going to make you more mindful, kind of being in the present moment, or just creating positive experiences. I do always say to my parents that I speak with, in my work, but then also in my presentations, is make sure you're watching your own actions and behaviors, right? Kids watch their parents. They watch their teachers, they watch their coaches, right? Authority figures. So that's where they get their cues on like what the best thing to do or like how best to approach different situations. So if you're modeling and showing that like, okay, so like bad things happen, stressful things happen, and I can manage them in a healthy and helpful way, then our kids are going to start to pick up on that as well. It's like, okay, like let me focus on the healthy and helpful instead of the unhealthy and the unhelpful. So we want to model healthy behaviors. We also want to trust our gut. I've said it a couple of times already, right? Like trust our gut. Assume, especially when it comes to someone talking to you about suicide or you noticing a change in someone, assume that you are the only person that knows, and assume that you're the only person that's going to reach out. We do not want to get into bystander effect where it's like, oh, well, they probably told mom or they probably told dad or sister or teacher or coach or whomever. We do not want to make assumptions, especially around conversations about suicide, because there's too many instances. People talked about a concern for someone or the person themselves talked about a concern they were having, but nobody reached out directly and it did not end up well. Like I said, so what is healthy, what is helpful? So dimensions of wellness. So these are just the 9 dimensions of wellness. And so it's just important to be thinking about, what does well mean to you, right? So what does it mean to be well? How do these areas intersect, right? These 9 different areas, how do they intersect? Where do we think we are in each of those areas, right? Again, like modeling, because then we can kind of have these conversations with kids, with loved ones. And do we feel in balance? Right? When we feel like our wellness is balanced, we tend to be and feel more healthy. We're doing the more helpful things for us to progress our life in the direction that we want it to go, right? Kind of creating a full and meaningful life when we feel well. When we also are balanced, like kind of in a balanced state, it leads to lower stress. And we are also able to manage stress easier. So healthy and helpful. What is healthy? What is helpful? Always a good question to ask. Self-compassion. So these are the pillars of self-compassion. So we have mindfulness, kindness, and common humanity, right? So mindfulness is a big thing. It is something that is in a lot of different places and for good reason, because essentially it's just saying being in the moment. If we're in the moment, so we know what's going on, we know how we feel, so we know our internal experiences, we know what's going on around us, we know our external experiences, and we're paying attention to them. That means that we have a full picture, right? We have full awareness of what's going on to the best of our ability so that we can make a decision from that place of awareness, right? Mindfulness, paying attention on purpose in the present moment, non-judgmentally. Kindness, so treating ourselves with some level of kindness. We beat ourselves up a lot. That kind of internalization can lead to increased thoughts of suicide among kids and adults. So teaching people how to be more kind to themselves and kind of give themselves grace. It's not letting us, self-compassion is not about letting us off the hook. It's not about saying that no bad things happen or we're trying to avoid bad things happening. That is not how life works. Life has suffering, bad shit happens. We are just approaching things with kindness. And like we make mistakes, right? Like, oh, I messed that up. Okay, what can I learn from this? Let me figure out how I don't do this again if I didn't like how that felt. Common humanity. So this is basically kind of creating experiences with each other, right? Humans are social creatures, right? This is why we do not do very well when we isolate. It can perpetuate depression, increase suicidal thoughts, is because we actually are meant to be around people. Now we do need a balance between alone time and time with others, that social interaction, but we are social beings. So kind of creating a common humanity, a connection, letting people know that they're not alone. That's why support groups are really great. Group therapy is really great. Different kind of social situations can be very, very helpful because you're learning that you're not alone. And you're not alone in your struggles. Everybody struggles. And so it helps to be thinking from a place of common humanity. So these are just different treatment options. So I like to just kind of put them out there. This is not an exhaustive list either. These are just kind of some different strategies that people will use to help people who are experiencing mental health challenges, who are experiencing suicidal ideations, or have engaged in some suicidal behaviors. So we have mindfulness-based ones over there with a nice little guy there. CBT, DBT. So we have cognitive behavioral therapy. We have dialectical behavioral therapy. Medications, right? Some people do need to link with a psych provider for medication assistance. We have flourishing up there, which is a positive psychology concept that talks about just kind of flourishing and allowing ourselves to achieve in kind of all those areas, feeling good in our life, not just being in survival mode, but actually transitioning to thriving mode. So it's just a couple. Like I said, there are way more. I do a lot of ACT myself, so that's acceptance and commitment therapy, positive psychology, which is on here, that kind of thing. So this is just a couple different strategies that you might see if you're going into therapy yourself, or if you are introducing a loved one to therapy. So now we're just kind of going into our resources section. So this is kind of the last one. I like to make sure that these are available for people to take down the information if they need it, if they want it. These are emergency resources, so 911 if needed. Crisis services is another one. 988 is the new number that people can call for support. They can call or text, actually. They have a text line. There is a kids helpline on here. As you can see, it's 716, so it's more local, but obviously kids can utilize the other ones too. You can utilize all of them for your kids, but they do have a kid-specific helpline, which is nice for those kids that have cell phones and maybe can recognize that they need a level of support. These are some local treatment resources. So these are some outpatient resources. This actually needs to be updated because Bryland outpatient is no longer a thing, but Bryland does have inpatient services still. So that's if someone needs to go inpatient. That's one of those hospital levels that we were talking about earlier, levels of care. Yeah, and so that is like a 21-day, 28-day program. There's different kind of inpatients like that. So Bryland does have that still, but now they're outpatient. These are some community resources. NAMI is an amazing organization. I recommend that everybody has some type of connection to NAMI. They are a national organization, but they have local chapters. So that's the one for Buffalo. CompYear, they do a lot of different things, but one of their huge highlights is a peer support program system that they have. So you can connect with a peer that you can kind of call, text, chat with, meet up in the community, really getting that social support. And then Mental Health Advocates, another amazing organization here in Western New York. They have a lot of different services for youth and adults. They're incredible. Can't say enough good things about them. Online resources. So these are just kind of some different like apps and things that people can use to help themselves kind of get into a good headspace. You got Calm, Headspace. Those are more mindfulness-based apps. 12-step that has more related to kind of substance use focus. And then My Strength that has a lot of different things on it. We help clients link with that and kind of sign up for that and everything like that. That's why it's a Horizon one. And then this is my contact information. So phone number on the one side and then my email on the other. I will say that if you don't want to play phone tag forever, if you have a question or if you want to know how to get linked with services or something like that, it's probably best to email me or email me with a time to call you that's best. And then, we can kind of figure it out from there. So like I said, I do always want to make sure that I have that at the end of my presentations. And that's it. So anyone that watches this, if you have questions, please just let me know. Anyone in here have questions at the moment that you want to be on?
Just want to say too, for anybody watching, just they're always welcome to call our office, the Family Support Center, providing you're a Clarence resident. Our number is 716-407-9244, and you can always reach out to us at FSC@clarenceschools.org. And before we get into questions on things like that, I just want to thank Shacarah and thank Horizon for putting on this event for us today. And for anybody who is watching, we really, want to take a preventative focus first. So anybody who does choose to watch this, and anybody that was in attendance today, I just want to thank you because even just one or two people can make a big difference in another person's life when it comes to these types of discussions. So thank you.
Thank you.